Hello, and today we are going to be talking about the PPO Prime plan from Independence Blue Cross. I'm going to begin by sharing my screen. So the Personal Choice 65 Prime RX PPO plan is available in Philadelphia, Buckchester, Delaware, and Montgomery counties. There is no premium associated with the plan, and for 2025, this plan is even going to give you $9.10 back each month towards your Part B premium. So yes, that's right. You are going to get paid to be on this plan. In addition, your primary is 0, specialists are 30. So this is still looking stable from 2024. Outpatient procedures have dropped down $200 for an ambulatory standalone surgery center, $350 at a hospital. Emergency is $100 a visit. Diagnostic tests, if you go to LabCorp, are a $0 copay. X-rays are $40, MRIs or CAT scans are $200. Inpatient hospital is going to be $250 per day for up to 7 days. So if you're in for 1 day, it's just $250. If you are in multiple days, you will not pay a maximum beyond $1,750. If you need any type of physical therapy, that is going to be $25 a visit. Over-the-counter allowance is $70 per quarter, and that does not roll over to the next quarter. And if all of your copays for inpatient and outpatient for the year were to reach $7,550, that is the maximum out of pocket and the most that you would pay. If you are also seeing out-of-network providers, then it's a combined in and out-of-network total of $11,300. Keep in mind, with a PPO plan from Independence Blue Cross, you have access to doctors across the country, everywhere except for Alaska. But even if you were to see an out-of-network provider, that's still going to be covered, but that's going to be a 40% copay. With this plan, you still have dental, vision, and hearing. All of your preventative dental care is going to be covered at no cost to you. There is a brand new dental network called Dominion. It's actually larger than the previous United Concordia network, and I'm told all but 9 dentists from the previous network are participating. And they are working on even those 9 and trying to get those included and moved over. But it's also possible if you had a dentist that was not participating previously, they may be working with this plan. So in addition to your $0 copay for your preventative dental, with the Prime plan, you also have $2,000 for comprehensive dental. You're still going to pay something. So with this plan, you pay 10% for fillings, root canals, crowns, and extractions. In addition, only 10% for dentures, even implants, partials, and some oral surgery. And Blue Cross would pay the remaining 90% until what you have paid and what Blue Cross have paid together reach $2,000. Vision is the same as it previously was, a $0 eye exam at any participating Davis Vision provider. In addition, you will get a free pair of Davis Vision eyeglasses covered in full, nothing fancy. In addition, you will also get $250 towards a pair of glasses at VisionWorks or $150 off any other Davis Vision provider. If you prefer, you can get a $150 allowance towards contact lenses. Hearing services, if you use True Hearing, which is a phone number that you call and they will tell you where to go, you can get a $0 hearing exam, $0 fitting and evaluation. And with your plan, your copays will be just $6.99 or $9.99 per hearing aid. So in the past, you received $300 to use towards dental, vision, and hearing copays or additional costs. That is remaining the same. So that $300 can be used towards any dental copays that you have or extra money towards eyeglasses or towards hearing aids. Telemedicine is going to be covered through Teladoc, and you can call in at no cost to you to speak to medical doctors, also mental health providers or dermatologists. Just like in the past, you still have your OnePass fitness membership that gives you access to multiple gyms across the country. Just make sure you call into member services if you have not already done so to get registered for your OnePass membership. Lastly, we are going to touch on the prescription drug piece. So with this, there is no deductible for any prescriptions that you pick up. Tier 1 and Tier 2 for next year are going to be a $0 copay. Tier 3 is 25%, Tier 4 is 50%, and Tier 5 specialty drugs are 33%. And if all of your copays for the year were to reach a maximum of $2,000, that is your maximum out of pocket, and Blue Cross will pick up the remainder of any of your prescription costs for the year. In addition, there is also the possibility for payment smoothing. So if you don't want to pay a big chunk for your drugs at the beginning of the year, you can sign up for the payment smoothing program. It's called the Medicare Prescription Payment Program, and they will divide the cost of your drugs by the remaining months of the year. If that is the case, then you will be getting a bill directly from Independence Blue Cross instead of paying right at the pharmacy. So currently your plan, the Prime plan, is a 4.5 star rated plan out of 5, and we're waiting to see what the new star ratings will be for the upcoming year. But that is one of the highest star ratings that you will see out there for a PPO plan. So I hope you are enjoying your day. If you have any questions, please reach out to me, and I will be happy to discuss your plan or any others that you are interested in. Thank you, and take care.